Professor Luther?
So I have to leave my work and join you.
Yeah. So,
Anyway, yeah.
so right now Dr. Narasimha is demonstrating the ICU bed number 1. Her current problem is she has already had a myocardial infarction. Then she had the acute pulmonary edema, she was on ventilator, and then she developed atrial fibrillation. From there we noticed that she has developed hemiparesis. So we were thinking of a cerebral embolism. Today morning we had a discussion around her and we realized that she was already having hemiparesis when she had come, even at the time of admission, but now she has become completely hemiplegic. So the stroke has progressed, her MI has become better, so she is out of the ventilator now, and her attendants wanted to take her home. I actually texted you about that. I wanted the admin PGs also to come and counsel, and we had a very good counseling session in the clinical lecture hall today, where the admin PGs also counseled them very well, and the patients have agreed to stay for another 1 week. Otherwise, they were going Lama today in the morning. So now we are assessing the patient's higher mental function as to why she is comatose even now. So Dr. Narasimha is presenting from there, and he is trying to tell us the Glasgow coma scale to begin with. So according to Dr. Narasimha, it is E2 VT, that is she is still having a tube inside a vocal cord, and M3. M3 or M4 is what we are trying to decide. So her lower limb, as you can see, is flexed. Narasimha, can you show us the lower limb? Yeah. So it is flexed and it is flexing and extending on its own without any painful stimuli. As you can see, it is just spontaneously doing it. So we wondered whether she is responding to painful stimuli or even the upper limb would also be the same. So we wanted Narasimha to open the upper limb and see. And I'm not sure what Narasimha has seen. Narasimha, what have you seen about the upper limb? Can you tell us?
So now she is localized, moving the limb towards the painful stimulus.
The upper limb, you mean?
Yes, sir.
If you leave it alone, will she, without giving her pain, will she move her hand?
I think
Just free that hand from the railing.
just a free from the distance.
So we can see it is still in between the railings there. Okay, fine. So now she is not moving her hand. Now if you give her some supraorbital pain, see what is happening? Supraorbital pain. So she is localizing, isn't it?
Moving towards the
Localizing to the pain.
right to this.
Yeah, so what is the Glasgow coma scale?
E2, VT, M5.
M5. Localizing to pain. And M6 is obeying commands. Isn't it?
It is confident to
Huh?
6.
Huh?
That is M6, sir.
M6 is obeying commands.
Yes, is spontaneously moving.
M6 is spontaneously moving.
Yes, sir. She's getting to follow at the pace. He's scratching her head, sir. That is spontaneous.
Okay. No, yeah, we are not able to see the face, so we are not able to, but you feel that it is spontaneous. Okay, that's very
Even
good.
I opening is E4, sir. Spontaneous.
Acha, that also.
Yes, sir.
So spontaneous eye opening and spontaneous scratching of the face.
Spontaneous eye opening.
So that means her sensorium from morning is quite better now.
Yes, sir.
Okay. So can we transfer her to AMC today?
You intubated, sir.
Yeah. So can we extubate her? Because one of the reasons we are not able to extubate is the consensorium. So if she is now well conscious, so we can extubate her then.
In the morning, we tried on TP, sir, but saturation for not maintaining on the TPs. Because TP is high. TP is 8. 100 TPs. TP is 0.5.
Huh?
Her TP is high, sir. Her TP is 8 centimeters.
Okay.
So she can't tolerate TP, sir. TP is atmospheric pressures.
Alright. So she's been on TVs for.
Straight away, sir.
Huh?
She can't be extubated straight away.
Alright. So,
Yeah, her peak has to come down to 6 or 5 I think.
no, but are we able to see her peak? Because she is just on a TPs.
Currently she is connected to ventilator, sir.
Acha, just you connected. Acha, you connected it just now.
Yes, sir. No, sir. But not with.
Okay, okay. And that was because of the fall in saturation, is it?
Yes.
Oh. Okay.
Why is she very high?
Alright. So there's a new development. We didn't know this. That she is back to the ventilator then.
So the question is why is she requiring high peak?
Yeah. Like if she, it was all KILIP 3 pulmonary edema, by now she should have recovered. Although she was also in KILIP 4 cardiogenic shock. So that somehow recovered on its own. And pulmonary edema is something which is being thought had recovered in the morning because 2 days she was on the ventilator. But now, since last 1 hour, you have noticed that the saturation has again gone down. So she is back to where she was probably. And we have to see what happened to the lungs. Why has she again gone worse, or why has she again worsened in terms of gas exchange? Isn't it? So what do you feel? What was the reason? Yeah, how much of FiO2 are we able to give? 50%, 60. So she is requiring 60 FiO2. And in the morning she did not, how much FiO2 was she requiring in the morning on TPs? Any idea, Narasimha?
It was after 10 liters we tried, 10 liters.
So in the morning she was requiring 10 liters. Okay. And what about yesterday, the whole day she was on TPs?
No sir, today morning only we tried.
Oh, so only today morning she was on TPs, not yesterday.
Not this. Everyone here.
Okay. Alright, so basically we were trying to take her off the ventilator, wean her off completely, but it is not succeeding, isn't it? So what are the questions you would like to ask the Elmina consultant in this situation? So one is, what could be done for this, the fact that she is continuing to require a ventilator? What could be the possible reason? What is wrong with the lungs? If we think it is only pulmonary edema, why is it not subsiding yet? Or is it that the heart is recovered good enough to maintain the pump, but not good enough to maintain the left ventricular and diastolic pressure? That's why her pulmonary edema is still persistent. So do we have an echo here to show us how much of improvement has happened from day 1 to now? Day 14 almost, or day 7?